Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. As you can see, I just took my mask off. No question, masks save lives, save illness, save problems for the family. It's not a political statement, it's a reality, so here it is. I'm putting it down. So we have a topic which is very important. It relates to a lot of normal daily, when I say normal, daily things, but I think it gave us some very interesting perspective coming our way because of this insidious pandemic. So we're going to try to talk about the understanding of mental health, anxiety, depression, self-harm. Let me introduce our guests. First we have Veronica Cartagena, who is a business development and educational outreach for Bougainvilla House in Fort Lauderdale. Welcome, Veronica.
Great, thank you, Dr. Lippman. Happy to be here.
Thank you. And Katherine Lewis, L.M.F.T, who is a clinical director, and we're very proud as an alumnus of Nova Southeastern University at the Bougainvilla House in Fort Lauderdale. Welcome, both of you. So, we'll start with you, Veronica, and the reason I'm going to start with you is because I want you to tell us, because you're the business development person as part of your title, where is the Bougainvilla House?
We are in Fort Lauderdale, just South Fort Lauderdale. I would say if we're looking at crossroads, 17th Street Causeway and Federal Highways, probably the most common. Nowadays, everybody recognizes us as being right across the street from Whole Foods with the new big building that they just built in front of us. But we're in a nice, cozy residential area, which is very nice for our clients here and the ambiance that we have here at the Bougainvilla House.
So you're within the region of Broward General, correct?
Correct.
Right. Okay. And so, Katherine Lewis, tell me what, as clinical director, what are your overwhelming chores, and tell us what L.M.F.T is.
Thank you, Dr. Lippman. So yeah, I am a licensed marriage and family therapist. Like Dr. Lippman mentioned, I'm a very proud graduate of Nova, both undergrad and my master's. So my role here as clinical director is I oversee all of the clinical programming. So that actually encompasses, we have 15 therapists that I oversee, as well as some wonderful interns that we also have coming from a bunch of the programs at Nova. Within that, I'm, making sure the day-to-day is we're operating fine. I'm there to manage any crisis and, check through documentation and things like that. So lots to be responsible for, but a wonderful program to be responsible for.
Tell me what let's talk about this mental health issue and in general, which includes anxiety, depression, the self-harm and things of that nature. Let's just talk in general, and it's all yours. Let's start with you, Katherine.
So here we work primarily with adolescents, and in the recent, definitely in the past year, we've seen a lot of increase with mental health issues within that population. When we're talking about anxiety and depression, there's definitely the clinical, definition of what that looks like, but we're seeing it with our adolescents, it's coming out in these different behaviors. So, a student maybe who once was getting their work done, they're gung-ho for school, has withdrawn and they're not, participating in class as much. Or maybe with the anxiety, some of these students, they're the top sports, varsity team, and then they're just feeling very overwhelmed, and it is very, essentially they freeze, they can't do anything. So it can look very different, and we see it, presenting in different ways within our adolescent population. We're seeing it even more so too with children, as young as, 6, 7, even we have a couple younger 4-year-olds that we do some play therapy with. And, in that sense, being home this past year and not being able to go into pre-K or do those, social sort of activities and things. That's an important age, 3 to 5, that social emotional growth happens there. And when a lot of these children haven't been able to do that and they've been isolated, it's been very difficult, and so we're seeing a lot of different behaviors even in the younger children, and it's some manifestation of this anxiety, this depression.
I think there's a lot of folks that really don't understand what the non-adherence to policies to bring children back into the classroom has an effect, or you tell me the effect that it has had relative to self-harm.
So something that we've seen here, definitely there's been an increase in some of those self-harm behaviors. What I've seen with my personal clients that I work with, that they tend to engage in the self-harm behavior when they're feeling very out of control, and it might come in, after a very heated, argument with mother, father, family member. It might be that they're just at the end of the day, very isolated, and it's some sort of, they feel something, and so we're seeing an increase in that definitely within our population. When it comes to the suicide and the suicide ideation and those sort of things, it's tough because so many of our kids will have those ideations. They have these thoughts and they'll verbalize, what if I wasn't here tomorrow? Would it be better if I wasn't here? And then there's the next step, which is when it becomes very concerning. There's that intent or a plan. And so we'll have a lot of kids that'll come in and the parents will bring them in and they'll say, I'm very worried, I want to bankrupt my child because I think that they're having this suicide ideation. And a lot of times it's those intrusive thoughts because they're so overwhelmed, they're so maybe depressed, they're feeling so out of control with what's going on in their lives. So it's been, and I'm sure they do a lot of this with the research that they do at NOVA, but the idea is that how do we work through what is an ideation and how do we prevent there being intent and a plan? And it's been pretty alarming to see such young children that we have coming in, maybe 11, 12, having these ideations.
And what about the effect of, and again, I think it's really a subject that changes day by day, the unemployment issue or the change of job structure. Have you seen that affect what one would say is anxiety, maybe depression, and maybe even cause greater harm to themselves? How is that working? Tell me what you see at Bougainvilla.
So a lot of what we do here, we're working with children and teens, through life transitions. So kids graduating high school, going to college, things like that. So even for some of the adults we see, because we do have some adult clients as well, that transition to maybe go back into the workplace, it's a huge change. After this year we've had, working remotely, we've had to change our whole entire day-to-day routine. It's a very big transition. And so I know for a lot of my clients that I have, some that have some health issues, the anxiety when they have some workplaces that are saying, you have to come back in, the anxiety increases because they start to have more of those thoughts of, what if I get sick? If I get sick, what's going to happen to my kids? If my kids don't have me, what's going to happen? And it starts that chain effect of all those worried thoughts. So definitely the transition back into the workplace, I've seen a big increase in anxiety with not only our kids going back to school, but also the adult clients that we have as well.
Veronica, I know you're involved with business development, but I want to focus in on educational outreach because I really think that what Katherine has just talked about really relates to how do we get the interest of the community at large external of just being at your facility.
Sure, absolutely. We do. Our outreach program primarily is in the education system, so it's in the school system. So we are approved speakers for Broward County schools, and right now, currently, we have about 36 partnerships with 36 different schools. So the beauty of that, it allows us to get in front of the kids and talk to them about what's trending. So whether it's about social media and its effect on our youth, or it's about anxiety and depression, or suicide and self-harm. So we have different talks that we do workshops and seminars that we do at the schools. We've done them at fire stations as well. We have some partnerships with some hospitals, especially with residential programs where once the kids are released from the residential programs, they need to go somewhere. So it's not just culture shock going back into society, right? So we have that step down program, which is our intensive outpatient program. So, but as far as the education outreach, we want to be there in front of the kids. What we know is the Z generation is much more open to health, to mental health and seeking care. So each generation, as we see, going back to the baby boomers, right? Each generation gets more and more open to mental health, and whether they're noticing more, are more open to talking about it, whatever the case might be, we start recognizing and opening up to mental health. And but the beauty of the Z generation is that they're actually more open to getting the care that they need, and that's where the other generations don't do. So they're much more vocal. They understand mental health and its effect and their ability just to cope with daily living. And that's what we're here for. So we want to be in those schools. We want to be talking about it so that we take more of a holistic approach when we look at our physical care and healthcare. It shouldn't be just physically getting that annual physical. We should look at our mental health as well as part of an annual checkup. And I think that that's where we kind of fall short, because by the time the kids come to us or our clients come to us, we're at a DEFCON 10 now, right? Some of them are self-harming, and now, we can still help them, but how much nicer and easier would it be for our kids to, or our clients to come in when things are maybe not so chaotic and crazy for them? Maybe it's just because they're struggling right now, just struggling through a transition from junior high to high school, or as Katherine mentioned, high school to college is a big transition. So that's where the educational outreach works for us, and we see the benefit in that, as well as platforms such as this, where we're talking about it, raising awareness. This is what we need to be talking about. We need the community involvement. Because even if you don't have kids, right, they're your future employees. So everybody should have, should be involved, because we're all affected. These are our future leaders. And how are they going to lead if they can't deal with, just regular life struggles? So it's a matter of knowing and learning whatever those coping skills might be to help them, just live a natural and healthy life.
They don't feel like they fit in. And that's where Bougainvilla House comes in. Is that correct?
Yes, absolutely. We have the beauty of our program, and of course I'm biased because, we're here, but one of the things that we've been able to do is that we're looking at it as a whole. So it's not just your traditional outpatient sessions with our clients. We're giving them individualized, I hate to use the word treatment, but programming to what suits their needs, what they need, again, just to live a normal and healthy life. And so in dealing with our adolescents, we've noticed that there's a couple of gaps that we've been able to fill in, such as our workshops. So we have these parenting workshops where, and if you have kids or grandkids, I'm sure that, each generation tries to figure out, how do we communicate with the next generation? And that's where these workshops come into play. So, where our clients are, being counseled with, with our counselors and our therapists, such as Katherine, then we have the parents hopefully in getting more involved in their care outside of the center. And part of that is, just learning how to be a better parent, learning the signs. I'll tell you one thing, where you mentioned about, the pandemic and everything that we've been going on for the past year and a half. And I know the mental health is not new. It was here prior to the pandemic. When we look at suicides, suicide's the second leading cause of death in adolescents from 10 to 24. And this was before the pandemic. So has the pandemic exacerbated mental health? Absolutely. But the one thing I have to say that it has shed a light on, where everybody being home, the parents recognize that there's something not right, or that their kids need a little more help, because now they're home to see them, because we're so busy at work, and now most people have been working at home, and the kids are in school at home, and now they have them 24/7. And it's also, in addition to not having the activities that they get extremely busy with, I think that people have actually noticed that there is a problem. And we're so fortunate and lucky that there is a solution to the problem, that it can be helped. This, again, we shouldn't wait till our kids are self-harming. And, social media, exasperates it, it glorifies it. And where do kids go to learn? Social media. I know, unfortunately, that's their platform.
Yeah, I know. We were just talking yesterday with a couple of colleagues of mine about the unfortunate destruction inside of our school system of bathrooms all of a sudden and things of that nature. To me, I guess you can call it acting out. Why don't we talk about that for a while?
I'm glad that Veronica brought up the aspect of these issues with mental illness being around way before COVID, and I think something that I've noticed as well is that COVID kind of, for those generations and those parents maybe who are still very rooted in that stigma against the idea of mental health care and things, I think it sort of gave them almost an out to say, oh, it's because of COVID, which isn't ideal, but at least it got the kids here, and it got them here, and it got the parents here. And like Veronica mentioned, we have our parenting workshops, and we do a lot of family therapy. We are a family therapy center, and obviously as a licensed marriage family therapist, very important, and so bringing the family in and, having the parents learn a little bit of like what their child's communicating, like you mentioned, the kids that are, doing these things to the bathrooms at school, teens especially, they don't have the ability to kind of think things through. They don't have that. Their brain hasn't really developed to that point yet where they can think, oh, if I do this, this is going to affect this, and then this will be this consequence. They're very impulsive, and that's just where their brain's at that age. And so, through our programming as well, and our therapists work really hard to kind of help teens and the kids kind of understand that there's a bigger picture, there's a ripple effect. And we also do that with the families and the family therapy. It is, to sort of highlight that, a parent doing this or doing that, it has an effect on the whole system. The system has to move and maneuver in some way to maybe, adjust to help that issue or whatever it might be. So the family dynamics is huge, and so I'm so glad that we have our parenting workshops as well to help with that. I think that one thing that's really important is for parents anyway, if there's any kind of message I can give, is to listen to your children. And that doesn't mean just listen to what they're saying, but listen to what they're doing. Look at their behaviors. And like Veronica said, this year people have had to be at home and they've had to listen a little bit more, because when parents are super busy with work and they're coming home, you're seeing your kid for maybe an hour and you kind of get out of touch. So one thing, I've talked about with my families and the clients I work with is doing like a check-in, when you have a dinner and you guys talk about what's going on for each other individually and then as a family. So that's something that is really important, especially during these hectic and very busy times.
One of the, I guess you could say, long-time traditional thoughts over the years has always been, like I said before, the utilization of a lot of pharmaceutical products and also street products and alcohol. And I noticed just recently, I'm a Wall Street Journal, well, I shouldn't be talking about what papers I will read, but I read the Wall Street Journal often. And I was looking at the tremendous increase in the sale of spirits, otherwise known as alcohol in a bottle. And I wonder if you're seeing more of that in your care and study of the family structure.
One thing, so at Bougainvilla House, we also work with substance use, and so we have a program for adolescents, which is an intensive outpatient program that focuses on, working through those issues as well. I personally, I always see that the substance use, that is a symptom to a lot more that's going on, underneath that, but it becomes this like crutch and this thing they lean on, and this this way of life almost to get through life, you know? And so one thing that has been very apparent with working with our families is for parents to understand that their behaviors, their teens, just like when the children are little and they're soaking up all that, they're like sponges, they're seeing the way parents are coping with their behaviors, and they're doing things such as, you know, come home from a long day at work and you're, you know, drinking 6 beers, and then, you know, and that's to each their own, but having conversations with your child and your teen that, you know, this is because, you know, I'm working hard, I'm doing things, whatever, you're a kid, and there's healthier things that you can do if you're stressed, there's healthier things that you can do. And so our program, our substance program, really focuses on, especially with teens, it's tough, being like, you know, we understand that there's people at your school vaping, there's people smoking weed, there's people drinking, you know, there's parties happening. We want to empower the teens to be able to kind of make the decisions for themselves that are going to be healthier. And it's been difficult sometimes when family members tend to like exhibit those same behaviors. So it's really important that we kind of work with the whole family when it comes to the substance use issues. And we do see, and I mean, there's a lot of studies on it, that there is some, whether it's, I mean, I wouldn't agree that it's some kind of like genetic thing, but the family with, you know, when there's substance use, we tend to see those patterns. We see, you know, if there's some serious substance use with grandparents, we see it with the parents, we see it with the children. So it's really important to be having that conversation with the whole family.
Veronica, you know, with educational outreach, do I assume, I heard about your relationship with the school districts, but do you go beyond that level? In other words, for example, you speak about the students entering into the higher education, the new students that go into higher education. They're just 1 month or 2 months away from where you were offering some help. How far beyond the school system do you go?
We actually go in any one of the institutions, whether they're the private schools, public schools, universities. The thing is that even though we, you know, as I mentioned, we're approved speakers, it's not to say that everybody has to allow us in their doors. So it is up to each administration to allow that partnership. And as to what level. So we have gone, you know, through, you know, several different schools, and not all of them are public schools. We do work with a lot with the private schools. And we have reached out to universities, and again, a lot of the universities, you know, such as yours, they're staffed with, you know, counselors. But we do want to be that extension, you know, because if we look at how many kids there are, just Broward County alone, I mean, we couldn't handle that if we know 1 in 5 kids, you know, suffer with some type of behavioral health issue. We have over, you know, 300 kids in Broward County. We wouldn't be able to handle that alone. Not even all the counselors, and that's a big problem that we have. Also, there's a shortage of counselors to be able to meet the needs. You know, if we were in full force where people were really getting those self checkups and all that. So, but we do reach out to really everyone. We've also been on EAP programs with certain corporations, which is an employee assistance program. Many corporations, especially the larger companies, might allow, you know, that they in-house will financially fund their employees to go and get a couple of sessions of mental health care. And so we are in quite a few of those programs as well. We're open to always expanding on that, you know, wherever we can.
If I might, we're down to the last 2 minutes of this show. I really have a lot more questions, but how does one get in touch with Bougainvilla House? Do you have a telephone number you'd like to tell us?
We do. Our telephone number is 954-764-7337. You can also reach us on our website, which is tbhcares.org. There's contact forms on there and we reach back out within a 24-hour period.
The reason I wanted to talk about the mental health, anxiety, depression, and self-harm, which is a very broad subject. We talk about it at least once or twice a year through this program presentation. because we have some of the world's preeminent people in the area of suicide prevention and self-harm at the School of Psychological Studies. So we try to bring that out because that's part of healthcare. That's what Dateline Health is all about, is trying to help the people who ask questions. And we've had a lot of queries about, well, what do we do? Where do we go? How do we deal with it? So I'm pleased that both you, Veronica Cartagena and Katherine Lewis, thank you kindly for offering your time to us. And I hope that the people out there recognize that there is a possibility for them to gain some access to knowledge and intervention through your presentation. Folks, I always tell you that this is your program, and there's been a lot of queries of us, primarily, really, you hear it all the time about mental health issues due to the pandemic, but I thought we'd widen it out a bit, and that's why I asked the people from the Bougainvilla house in Fort Lauderdale to try to make that presentation. So we thank you both. Remember, folks, as I always say, this is your show. Right here, there's a telephone number and an email address which you might want to either send questions to or other. We will pass it on to our guests. And we want to thank you. Remember, I always tell you, you got to take good care of yourself, and your health care is your health care. And you have to communicate. So when you see your doctor, if you can't sleep, or you're taking things to calm yourself down, you got to let your doctor know. Whether you're there just on a checkup because you think you got a cold, or you have an instance of harm other than mental health, you got to let the doctors know. They're there to help you, and we hope that you take advantage of your knowledge given to the doctors, and they'll be able to help you out. Remember, this program is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.